Schizophrenia is a severe mental disorder that changes how someone thinks, feels, and makes decisions. They appear to have lost touch with reality, which can cause distress for them, their loved ones, and friends. According to the National Institution of Mental Health, there are categories for symptoms of schizophrenia, such as positive symptoms, negative symptoms, and cognitive symptoms. But let us go a little deeper by focusing on changes in the brain function, brain structures, and the central nervous system when it comes to schizophrenia. People within their late teens and 20s show signs of schizophrenia. Within people that suffer with schizophrenia disorder, functions are affected. When it comes to thinking, they may have a hard time with organization or making connections. They may have thought withdrawal or thought blocking. Within behavior, they have senseless talking, showing agitated or no expression, or having repetitive actions. Emotional-wise, they may have outbursts or show signs of strong negative feelings. Dopamine dysregulation is also observed in brain regions including the amygdala and prefrontal cortex, which is important for emotional processing. Positive symptoms are psychotic behaviors that are not typically seen in people without schizophrenia, like hallucinations, delusions, and agitated body movements. Positive symptoms of schizophrenia include hallucinations and delusions because of increased subcortical release of dopamine, which is thought to be due to a disturbed cortical pathway through the nucleus accumbens. Negative symptoms interfere with a person's behavior and emotions, like reduced speaking, difficulty starting activities, and little to no pleasure in everyday life. These symptoms come from receptor activation in the prefrontal cortex and increased activity of the nucleus caudatus. Researchers also studied that alterations might be involved in the negative symptoms of schizophrenia. Studies show that NMDA receptor antagonists, including PCP, MK801, and ketamine, lead to immediate psychological effects that resemble positive and negative symptoms in schizophrenia. Lastly is cognitive symptoms, which is like trouble paying attention and trouble using information to make decisions. Cognitive symptoms include problems with attention, concentration, and memory. There are two types of memories when dealing with schizophrenia disorder. Verbal declarative memory, which is located in temporal lobe, is a core cognitive domain affected in schizophrenia in the encoding stage, also meaning learning of information. And then there's working memory, which is located in the prefrontal lobe and could possibly be due to dysfunction of establishing or changing brain networks. Scientists think that differences in brain structure, function, and interactions among chemical messengers, neurotransmitters, might contribute to the development of schizophrenia. According to dopaminergic, abnormal and mesolimbic and prefrontal brain regions exist in schizophrenia. Research has indicated that glutamate, GABA, acetylcholine, and serotonin alterations are also involved in the pathology of schizophrenia. According to NIMH, excitatory neurotransmission in the brain is mainly glutamatergic, and these neurotransmissions occur through metabotropic and inotropic glutamate receptors. Excitatory amino acid glutamate and the inhibitory amino acid are involved in the pathophysiology of schizophrenia. Because schizophrenia is incurable and requires lifelong treatment, antipsychotics medications are prescribed to be taken daily, and psychotherapy is taken after effective medication has been given. Side effects of taking antipsychotic medication can be weight gain and movement disorder. Schizophrenia is a severe mental disorder that changes how someone thinks, feels, and makes decisions.